Gentlemen, let me ask you a question that many men over 50, 60, or even 70 have quietly wondered about, but may feel uncomfortable saying out loud. If you still masturbate as you get older, have you ever stopped and asked yourself, is this actually healthy for me? Or could I be causing some kind of damage without realizing it? If that thought has crossed your mind, you are certainly not the only one. Many older men continue to experience sexual desire and self-pleasure well into their 60s, 70s, and beyond, yet they may carry unnecessary guilt, uncertainty, or conflicting information about what it means for their health. Some worry that masturbation could make them weaker. Others wonder whether it affects the prostate, erections, testosterone, or sexual performance with a partner, and some men simply do not know what is normal as the body changes with age. So today, I want to have a straightforward conversation about this subject without shame, embarrassment, or outdated myths. We are going to look at masturbation from a biological, emotional, and practical perspective, including where it may be helpful and where certain habits can become a problem. I'm speaking from the perspective of a medical professional who works with men's health, and my goal is not to tell you that masturbation is either completely good or completely bad. The reality is much more balanced than that, and I want you to stay with me through this discussion because understanding your body can change the way you approach aging, sexuality, confidence, and your overall well-being. Before we get into the science, if you appreciate clear and sensible information about men's health, take a moment to like this video, share your thoughts in the comments, and subscribe so you can continue following these conversations about healthy aging, vitality, and longevity. Now, let's get into the topic. The simple truth is that masturbation in an older man is not automatically harmful, and it is not automatically beneficial either. What matters is the way it fits into your overall physical and emotional health, how frequently you do it, and whether it is interfering with other parts of your life. Think of it as one behavior within a much larger picture of health. For years, men have been given very different messages about masturbation. Older beliefs sometimes suggested that ejaculation drained a man's strength, damaged the prostate, or somehow reduced his masculinity. On the other hand, some modern claims go too far in the opposite direction and present masturbation as a cure for almost every problem. Neither extreme is helpful. Good health advice requires balance. Research suggests that sexual activity and ejaculation can have several potential benefits, while certain habits surrounding masturbation can also create physical or psychological problems. Understanding both sides is far more useful than simply labeling the behavior as good or bad. In my experience, many older men are less interested in judgment than they are in getting a clear answer to one simple question: "Doctor, is it okay that I still have these desires?" And the answer is that sexual desire does not automatically disappear because you reach a certain birthday. Your body changes with age, but your sexuality, emotions, and need for intimacy can remain an important part of your life. That is why conversations like this matter. Prostate health, erectile function, pelvic muscles, emotional well-being, and sexual confidence can all overlap in ways that deserve attention. So let's begin with the potential benefits, and then we will also discuss the situations where caution is important. The first potential benefit is maintaining awareness of penile function and supporting regular erections. An erection is not simply a sexual event. It is also a vascular process in which blood flows into the erectile tissues of the penis, allowing those tissues to expand and become firm. Regular erections may help maintain the normal function and flexibility of those tissues. As men age, changes in blood vessels, medications, diabetes, cardiovascular disease, and hormonal changes can all affect erectile quality. Sexual stimulation can therefore provide an opportunity to remain aware of how your body is functioning. It is important, however, not to think of masturbation as a medical treatment for erectile dysfunction. If erections are becoming consistently weaker, disappearing, or changing significantly, that deserves proper medical evaluation rather than simply trying to stimulate yourself more often. The second potential benefit relates to the prostate, although this area needs some careful explanation. Research has found an association between more frequent ejaculation and a lower risk of prostate cancer in some groups of men. That does not mean ejaculation prevents prostate cancer, and it certainly does not mean that every older man needs to masturbate a specific number of times to protect his prostate. The relationship is more complicated than that. Still, the research has made prostate health and ejaculation an interesting area of study. For men over 50, the most important point is not to rely on masturbation as a substitute for proper prostate care. Regular medical checkups, discussion of urinary symptoms, awareness of family history, and appropriate screening decisions remain much more important. The third potential benefit involves the pelvic floor. During orgasm, the muscles of the pelvic floor contract rhythmically. These muscles play important roles in bladder control, sexual function, and support of the pelvic organs. Maintaining awareness and function of this muscle group can be useful as men grow older, especially because pelvic floor strength can change with age and inactivity. However, stronger pelvic muscles do not automatically mean stronger erections, and masturbation should not be viewed as a replacement for targeted pelvic floor exercises when those exercises are medically appropriate. The fourth potential benefit is relaxation and stress reduction. Sexual stimulation and orgasm can be followed by changes in several brain chemicals and hormones involved in relaxation, mood, and emotional comfort. For some men, this may create a temporary sense of calm and make it easier to settle down at night. This can be particularly valuable when everyday life includes financial concerns, family responsibilities, loneliness, health worries, or the general stress that can accompany aging. But again, the key is balance. Masturbation can be one way to relax, but it should not become the only way you manage stress. Exercise, meaningful relationships, good sleep habits, time outdoors, and activities that give you purpose are equally important parts of maintaining emotional health as you get older. And this brings us to another important point: knowing your own body. When you remain aware of your normal sexual and physical function, you may be more likely to notice changes that deserve attention. A new lump in a testicle, persistent pain, a significant change in penile curvature, unusual sensitivity, blood in the semen, or a sudden change in erectile function should not simply be ignored. These symptoms do not automatically mean something serious is happening, but they are reasons to speak with a qualified healthcare professional. In other words, paying attention to your body can be useful, but self-examination should never become a substitute for medical care. As we continue, we also need to talk about sleep, pelvic circulation, sexual confidence, and maintaining desire with age, because these are areas where many men have questions but rarely receive clear explanations. And just as there can be potential benefits, there are also situations where certain habits can work against you. That is where the conversation becomes even more important. Another area many older men notice is sleep. After orgasm, some people experience a natural feeling of relaxation and sleepiness, and this may be related to changes in hormones and brain chemicals involved in calming the nervous system. For a man who has difficulty winding down at night, that temporary sense of relaxation can sometimes make falling asleep easier. But it is important to keep this in perspective. Masturbation is not a treatment for chronic insomnia, sleep apnea, or other sleep disorders. If you regularly wake up exhausted, struggle to stay asleep, or feel unusually sleepy during the day, the underlying cause should be investigated rather than covered up with a bedtime habit. Sleep becomes increasingly important as we age because it supports memory, mood, immune function, metabolism, and cardiovascular health. So if sexual activity helps you relax occasionally, that can be perfectly reasonable, but it should exist alongside good sleep habits and proper medical care. Another potential benefit is maintaining awareness of blood flow and sensation in the pelvic region. Sexual arousal naturally increases blood flow to the genital tissues and involves coordinated activity of the pelvic muscles. That does not mean masturbation literally cleanses the pelvis or prevents inflammation, as some exaggerated claims suggest, but maintaining normal sexual function can help a man remain familiar with how his body feels and responds. If you notice persistent pelvic pain, burning, numbness, swelling, or a major change in sensation, however, that is not something to simply accept as part of aging. Those symptoms can have many causes and deserve a medical assessment. The next potential benefit involves sexual control and confidence. Sexual response is partly a matter of learning to recognize your own physical signals. Some men with concerns about premature ejaculation may use techniques such as the stop-start method, where stimulation is paused before reaching the point of ejaculation and then resumed after arousal decreases. This can help some men become more familiar with their arousal pattern, but it should be approached gently, without turning sexual activity into a stressful performance test. The purpose is greater awareness, not pressure. And perhaps one of the most overlooked issues is desire itself. Many men assume that getting older means they should stop having sexual thoughts or wanting intimacy. That simply is not true. Libido can change with age, but desire may remain an important part of a healthy life. Sexual interest is influenced by the brain, hormones, relationships, physical health, medications, mood, and many other factors. Staying connected to your sexuality can help some men feel more comfortable with their bodies and their changing identity. At the same time, losing interest in sex is not automatically a medical problem either. Every man is different. The important question is whether the change is wanted and expected, or whether it is sudden, distressing, or accompanied by other symptoms. Now, with all of those potential benefits in mind, we need to discuss the other side of the equation. Because a behavior can be perfectly normal and still become unhealthy when it is excessive, physically aggressive, emotionally dependent, or interfering with real life. The first concern is social isolation. Masturbation itself does not make a person antisocial, but if it gradually becomes a replacement for human connection, it can contribute to withdrawal. This is especially important for older men who may already be dealing with retirement, living alone, loss of a spouse, reduced social contact, or changes in their family relationships. Sexual self-stimulation should not become a reason to stop pursuing friendships, affection, companionship, or intimacy with a partner. Human connection provides benefits that masturbation cannot replace. If you notice that you are consistently choosing isolation because sexual stimulation feels easier than interacting with people, that is worth examining. The second issue is physical irritation. The skin and tissues of the penis are sensitive, and excessive friction, especially without adequate lubrication, can cause irritation, soreness, small abrasions, or temporary swelling. These problems may sound minor, but repeated irritation can become uncomfortable and can increase the chance of skin injury. The practical solution is simple. Be gentle, pay attention to discomfort, and use an appropriate lubricant when needed. You do not need to prove anything through force or intensity. Pain is not evidence that you are doing something more effectively. If irritation continues even after changing your technique, give the area time to recover and speak with a healthcare professional if necessary. The third potential problem is becoming too dependent on a very specific form of stimulation. The brain learns from repeated patterns, and some men may find that if they always use exactly the same pressure, speed, position, or highly specific visual material, their sexual response becomes more narrowly conditioned. This does not mean that masturbation permanently damages the brain or that pornography automatically causes sexual dysfunction. Those claims are too simplistic. But if a man finds that he can become aroused easily alone but struggles to respond with a real partner, it is worth looking at the overall pattern of stimulation. Variety, moderation, and real-world intimacy can help maintain flexibility in sexual response. The fourth concern is using masturbation to hide an underlying erectile problem. This is particularly important after 50. If you can achieve an erection during masturbation but regularly struggle to maintain one with a partner, do not automatically assume the problem is simply psychological or related to your partner. Erectile difficulties can sometimes be associated with cardiovascular disease, diabetes, medication side effects, low testosterone, nerve problems, or other medical conditions. In fact, changes in erectile function can occasionally appear before other symptoms of vascular disease become obvious. That is why persistent erectile dysfunction deserves a proper evaluation. Being able to achieve an erection alone does not necessarily prove that your cardiovascular or hormonal health is perfect. The fifth issue involves posture and prolonged pressure on the pelvic region. Some men may spend long periods sitting in awkward positions while using sexual stimulation, and excessive pressure around the perineum can sometimes contribute to temporary numbness or discomfort. The pudendal nerve and surrounding tissues can be sensitive to prolonged compression. If you experience persistent genital numbness, burning, pelvic pain, or unusual sensations, change your position and stop the activity that is causing discomfort. Do not continue simply because you think you need to tolerate it. Your body is giving you useful information. The sixth risk is emotional escape. Masturbation can provide temporary relief from boredom, anxiety, loneliness, or frustration. But when it becomes the primary way you deal with every uncomfortable emotion, it may prevent you from addressing the actual problem. Imagine using the same solution every time you feel stressed. Eventually, the issue is no longer the sexual behavior itself. It is the fact that other coping strategies have disappeared. A healthier approach is to build a larger toolbox that includes physical activity, social contact, hobbies, relaxation, meaningful work, and, when needed, professional counseling. Sexual activity can be one part of emotional self-care without becoming the entire strategy. The seventh issue is guilt and shame. This is something I want older men to take seriously because decades of cultural messages can be difficult to unlearn. Some men were raised to believe that masturbation was dirty, weak, or morally wrong. When those beliefs remain deeply rooted, a completely ordinary sexual behavior can produce intense shame and anxiety. That emotional burden may be more damaging to confidence and well-being than the behavior itself. If guilt is interfering with your daily life, your relationships, or your ability to feel comfortable in your own body, speaking with a qualified, non-judgmental counselor can be extremely helpful. You do not need to spend the rest of your life carrying shame that came from someone else's beliefs. The goal is not to force yourself into a particular sexual lifestyle. The goal is to understand your own values and make choices that support your physical and emotional health. The eighth concern is pelvic or testicular discomfort when sexual activity becomes excessive. There is no universal number that tells every older man how often he should masturbate, because sexual frequency varies enormously from one person to another. But if you are having multiple sessions every day and you begin noticing aching, heaviness, tenderness, or discomfort in the testicles or pelvic area, that is a signal to slow down. Your body does not benefit simply because you reach a particular number of ejaculations. More is not automatically better. Give your tissues time to recover, pay attention to how you feel afterward, and remember that frequency should be based on comfort rather than competition. Persistent testicular pain, swelling, a new lump, or significant changes in the scrotum should always be medically evaluated rather than blamed on masturbation. The ninth issue becomes particularly relevant for men who are trying to have a child later in life. If fertility is a current goal, ejaculating very frequently can temporarily reduce the concentration of sperm in a particular semen sample. That does not mean masturbation causes infertility, and it certainly does not mean an older man must avoid ejaculation completely. Sperm production continues continuously, and fertility depends on many factors, including age, sperm quality, hormones, medications, overall health, and the health of both partners. For men preparing for a semen analysis or trying to optimize a specific sample, Clinicians may recommend a period of abstinence, often within a few days, depending on the situation. So if conception is your goal, talk with a fertility specialist rather than relying on rigid internet rules about how often you should or should not ejaculate. The 10th concern is becoming overly dependent on pornography or highly stimulating visual material. This is another area where we need to avoid extreme claims. Pornography does not affect every man in the same way, and simply viewing sexual content does not automatically cause erectile dysfunction or relationship problems. The concern arises when the material becomes so central to arousal that real-life intimacy begins to feel less interesting or more difficult. If you find yourself needing increasingly specific, intense, or unrealistic content to become aroused, while ordinary intimacy with a partner feels less stimulating, that pattern deserves attention. Real relationships involve touch, communication, affection, emotional connection, and unpredictability. Those experiences are different from a highly controlled digital environment. Maintaining a healthy balance can help keep your sexual response connected to real-life intimacy rather than making one form of stimulation your only pathway to arousal. So now we have looked at both sides of the conversation. The potential benefits are not a reason to turn masturbation into a health prescription, and the potential risks are not a reason to feel frightened or ashamed. The more useful question is this: how can you make sure that sexual self-pleasure remains a healthy and comfortable part of your life as you age? The first answer is frequency. There is no scientifically established number that every man over 60 must follow. You may hear claims that 2, 3, or 4 times per week is the perfect amount, but there is no universal prescription like that. Some men may masturbate several times a week without any problems. Others may do it less often. Some may not do it at all. What matters is whether the behavior feels comfortable, whether it causes physical irritation, whether it interferes with relationships or daily responsibilities, and whether you feel in control of the decision. Your body, not an arbitrary internet number, should be part of the conversation. The second principle is gentleness. Avoid excessive pressure, aggressive friction, or positions that leave you with pain or numbness. If lubrication is needed, use a suitable lubricant and stop if something hurts. Sexual activity should not leave you injured. A small amount of temporary sensitivity can happen, but persistent pain, bleeding, swelling, skin damage, or numbness is a reason to stop and seek medical advice. The third principle is awareness. Pay attention to changes rather than assuming every sexual problem is simply part of getting older. If your erections suddenly become weaker, if ejaculation becomes painful, if you notice blood in your semen, if there is a new lump, if your testicles become swollen, or if you develop persistent pelvic pain, these symptoms deserve proper evaluation. Men sometimes delay medical appointments because they feel embarrassed discussing sexual symptoms, but remember that urologists hear these concerns every day. There is no benefit in suffering quietly when a medical problem could potentially be identified and treated. The fourth principle is integration. Masturbation should fit into your life rather than become your entire sexual life. If you have a partner, it does not have to compete with intimacy. In some relationships, understanding your own body can actually make communication easier because you become more familiar with what feels comfortable and what does not. At the same time, real intimacy involves more than sexual stimulation. Emotional closeness, affection, communication, trust, and companionship are important parts of sexual health, particularly as couples move through different stages of aging. If you are single, the same principle applies. Self-pleasure can be part of your private life, but it should not stop you from building friendships, pursuing interests, exercising, traveling, or seeking meaningful human connection. Your sexual health exists inside your larger life. The fifth principle is mindset. This may be the most important one for men who have spent decades feeling ashamed about sexuality. You do not need to treat normal sexual desire as evidence that something is wrong with you. Feeling attraction at 60 does not mean you are immature. Wanting intimacy at 70 does not mean you are trying to act young. Having sexual thoughts at 80 does not make you abnormal. Aging does not erase your identity as a sexual human being. Of course, sexuality changes over time. Erections may take longer. Stimulation may need to be different. Hormone levels can shift. Medications and chronic conditions can influence desire and performance. But those changes do not mean that sexuality has to disappear. The goal is not to pretend that your body is 25 again. The goal is to understand the body you have today and care for it appropriately. And this is where I want to make an important distinction. Masturbation should never be used as a replacement for medical treatment. If you have erectile dysfunction, prostate symptoms, low libido, urinary problems, pelvic pain, or another persistent concern, do not assume that changing your masturbation frequency will solve the underlying issue. Sometimes sexual symptoms are the first clue that something else needs attention. High blood pressure, diabetes, vascular disease, medication effects, neurological problems, depression, anxiety, sleep disorders, and hormonal changes can all influence sexual function. A good doctor will look at the whole picture rather than judging you based on one behavior. So instead of asking, "How many times should I masturbate?" a better question is this behavior supporting my life, or is it starting to interfere with it? If you feel comfortable, remain physically healthy, maintain your relationships, and do not experience pain or loss of control, there may be little reason to worry simply because you continue to masturbate as you get older. But if the behavior becomes compulsive, causes injury, replaces meaningful relationships, or prevents you from recognizing an underlying medical problem, then it is time to step back and reassess. That balanced approach is far more useful than either extreme. You do not need fear, and you do not need false promises. You need awareness. Gentlemen, one of the most important things I want you to remember is that sexual health is not separate from the rest of your health. The way your body responds sexually can sometimes provide useful information about your cardiovascular system, hormones, nerves, medications, emotional state, and general physical condition. That is why changes in sexual function should be taken seriously without being treated as a reason for embarrassment. For example, if you have suddenly started experiencing difficulty getting or maintaining an erection, especially if that change is new for you, it may be worth discussing with your doctor. Erectile problems can sometimes be connected with conditions that affect blood vessels and circulation, including diabetes, high blood pressure, and cardiovascular disease. This does not mean every episode of erectile difficulty is a warning sign of heart disease. Stress, fatigue, alcohol, relationship difficulties, medications, and many other factors can temporarily affect sexual performance. But when a change becomes persistent, investigating the cause is the responsible thing to do. The same principle applies to ejaculation. Pain during ejaculation, blood in the semen, significant changes in orgasm, or persistent discomfort should not simply be dismissed because you are getting older. Aging can change sexual function, but it should not automatically explain every new symptom. Another important point is that there is no requirement for an older man to remain sexually active simply to prove that he is healthy. Some men enjoy masturbation regularly, some prefer sexual activity with a partner, some have little interest in sex. Others go through periods where their desire changes because of stress, medication, illness, grief, or major life events. None of these situations automatically means something is wrong. What matters is whether the situation is comfortable for you and whether a change is intentional or unexpectedly causing distress. If your libido has disappeared suddenly and you are concerned about it, that is worth discussing with a doctor because low sexual desire can sometimes be related to testosterone levels, depression, sleep problems, medications, relationship stress, or other health conditions. But if you simply have a naturally lower level of sexual interest and feel perfectly content, there is no medical requirement to force yourself to behave differently. Your sexual health should support your quality of life, not become another source of pressure. Now, let's return to the question many men have about frequency. You may see very specific recommendations online suggesting that every man over 60 should masturbate a certain number of times per week for prostate health, testosterone, circulation, or longevity. Be careful with those claims. Medicine rarely works through one universal number that applies to everyone. Research can show associations between ejaculation frequency and certain health outcomes, but that does not prove that increasing ejaculation will directly prevent disease. Your overall lifestyle has a much stronger foundation in healthy aging. Regular physical activity, maintaining a healthy weight, eating a balanced diet, sleeping well, controlling blood pressure and blood sugar, avoiding tobacco, managing stress, maintaining social relationships, and receiving appropriate medical care are far more important than counting how many times you ejaculate. Sexual activity can be part of a healthy lifestyle, but it should not distract you from the basics. And if prostate health is your concern, remember that masturbation cannot replace prostate evaluation. Pay attention to urinary changes such as difficulty starting urination, a weak stream, frequent nighttime urination, urgency, blood in the urine, or an inability to empty the bladder properly. These symptoms can have several causes, including an enlarged prostate, infection, medication effects, or other conditions, and they deserve proper evaluation. Do not assume that ejaculation will solve them. In the same way, if you are experiencing persistent erectile dysfunction, do not simply increase masturbation and hope that the problem disappears. A doctor may need to evaluate your medications, blood pressure, blood sugar, cardiovascular risk, hormones, and other factors. Sometimes the most valuable benefit of paying attention to sexual function is that it encourages you to take a closer look at your overall health. There is also an emotional side that deserves more attention. Many older men grew up during a time when conversations about sexuality were extremely limited. They may have been taught that a man should never talk about sexual worries, never admit insecurity, and never ask questions about his body. That silence can make completely manageable concerns feel much bigger than they actually are. If you are worried about masturbation, erectile function, prostate symptoms, or changes in desire, speaking honestly with a healthcare professional is a sign of responsibility, not weakness. Your doctor has likely heard similar questions many times. You do not need to use perfect medical language. Simply explain what has changed, when it started, how often it happens, and whether it causes pain or affects your relationship. Those details can help a doctor determine whether the situation is normal variation or something that needs further investigation. And if your main problem is shame rather than a physical symptom, that matters too. Sexual guilt can remain with a person for decades, especially when it comes from strict childhood messages or cultural expectations. You are allowed to examine those beliefs as an adult and decide whether they still serve you. Feeling sexual desire does not make you less dignified. Having private sexual habits does not determine your worth as a man. What matters is how you treat yourself and others, whether your choices are responsible, and whether your behavior is consistent with your own values. Another practical point is to avoid turning masturbation into a test of masculinity. Some men become anxious about how long they can maintain an erection, how quickly they can reach orgasm, or how often they can ejaculate. That kind of pressure can actually make sexual function more difficult. Sexual health is not a competition. There is no trophy for lasting longer, masturbating more frequently, or proving that your body works exactly like it did decades ago. Your body is allowed to change. In fact, adapting to those changes is part of healthy aging. You may discover that you need more stimulation, more time, different positions, more lubrication, or simply a more relaxed environment. Those changes do not mean you are broken. They mean your body has changed, and understanding those changes allows you to respond intelligently. If you have a partner, communication can make a major difference here. Instead of hiding changes in sexual function, talk openly about comfort, expectations, and what feels good for both of you. Intimacy does not have to be defined by penetration or by achieving a particular sexual performance. Touch, affection, closeness, kissing, conversation, and mutual understanding can remain deeply meaningful at any age. And for men who are single, there is no reason to view sexuality as something that ended simply because a relationship ended. Your private sexual life can still exist alongside friendships, hobbies, exercise, travel, community, and personal goals. Healthy aging is not about removing everything that once brought you pleasure. It is about learning how to keep those things in a way that supports your present health and circumstances. So when you look at masturbation in later life, do not ask whether you should be ashamed of it or whether it is some magical health treatment. Neither conclusion is accurate. Instead, ask whether you are comfortable, whether you remain in control, whether your body feels healthy, and whether the habit fits naturally into the rest of your life. Those questions will tell you far more than any rigid rule you find online. Gentlemen, let me leave you with the most important message from this entire conversation. There is nothing inherently shameful about still having sexual desire at 60, 70, or even 80. Your age does not automatically switch off your sexuality, and continuing to experience attraction, arousal, or the desire for self-pleasure does not mean that you are somehow failing to age properly. At the same time, sexual health should be approached with the same common sense you would apply to every other part of your body. Listen to your symptoms, respect your physical limits, and do not allow embarrassment to prevent you from getting medical help when something changes. Masturbation is not a magic treatment for prostate disease, erectile dysfunction, heart disease, low testosterone, or aging itself. But for many men, when practiced comfortably and without loss of control, it can simply be one normal part of sexual expression. The key is balance. If it feels comfortable, does not cause injury, does not interfere with your relationships or responsibilities, and is not being used to escape every difficult emotion, there may be little reason to feel guilty about it. But if you experience persistent pain, numbness, swelling, bleeding, major changes in erections, painful ejaculation, a new testicular lump, or other unusual symptoms, do not try to explain everything away as part of masturbation or aging. Talk with a healthcare professional and find out what is actually happening. Your body deserves that attention. And remember, the goal of healthy aging is not to become less human. It is to become more aware of what your body needs and to make informed choices based on that knowledge. Your sexuality may look different than it did when you were younger, but different does not mean finished. You may need more time, more stimulation, more communication, or a different approach with a partner. You may also discover that emotional connection becomes even more important than physical performance. These are normal parts of growing older. Your value as a man is not measured by the strength of an erection, the frequency of ejaculation, or your ability to perform exactly as you did at 25. Confidence comes from understanding yourself, caring for your health, and refusing to let outdated shame control your decisions. So, if you have been quietly wondering whether masturbation at your age is automatically harmful, the answer is no. But if you have been wondering whether there are habits that could become unhealthy, the answer is also yes. That is why awareness matters more than fear. Use moderation, be gentle with your body, pay attention to changes, maintain real human connections, and keep your overall health at the center of your decisions. And if you are concerned about your prostate, erections, hormones, fertility, or any other aspect of sexual function, remember that a proper medical evaluation is always more valuable than trying to diagnose yourself through internet advice. You deserve clear answers, not shame and not exaggerated promises. Your sexuality is part of your health, but it is only one part of the bigger picture. Protect your heart, keep moving, eat well, sleep properly, manage your stress, maintain your relationships, and stay engaged with life. Those habits will do far more for healthy aging than any single sexual behavior. If this conversation helped you understand your body a little better, tell me in the comments what surprised you most. Was there something you had believed for years that you now see differently? And if you want more straightforward, evidence-based conversations about men's health and healthy aging, make sure you like this video, subscribe to the channel, and turn on notifications so you do not miss the next one. Remember, getting older does not mean losing your dignity, your identity, your capacity for affection, or your ability to experience pleasure. Your body changes, but you can continue learning how to care for it. Stay informed, stay active, listen to your body, and never let embarrassment keep you from asking an important health question. Take care of yourself, gentlemen, and I'll see you in the next video.